welcome to ThePrint. With a 10% increase in budgetary allocations this year, the Ministry of Ayush has ambitious plans to expand traditional medicine in India. The ministry has announced this year in the budget that it will be coming up with three All India Institutes of Ayurveda. And to tell us more on what the ministry plans ahead this year, we have with us the Secretary of the Ministry of Ayush, Vaidya Rajesh Kotecha. Thank you so much for joining, sir. Welcome to ThePrint. So, first of all, I want to ask you, as we know that the allocations this year went somewhere close to 4,500 crores, which rose up to 10% from last year, which was 3,990 crores approximate. So, in the coming next 10 to 12 or 12 to 18 months, what are the top three outcomes that the ministry is expecting out of this increase in spending?
Let me first, go back to what was the budget before and what is now. Actually, if you look at 2014 allotment of RE stage revised estimate, it was only 691 crore, and this is 4,500 plus. So you can look at that, that in 11 years it went up to more than 8 times, around 8 times. So 8 times growth into budgetary support is something, very, 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 prestigious for us, and it helped us to be ambitious. And you may also have heard that, you already mentioned that we have these 3 new holiday institute of Ayurveda. There are some announcements. One of the announcement is upgrading the WHO Global Center for Traditional Medicine at Jamnagar, and then strengthening the ecosystem of drug regulatory framework, including drug testing laboratories, and then creating an ecosystem of global benchmarking so that we can have larger export as compared to now. Then you also may recollect that there is a mention of 150,000 caregivers where Ayush, Ayurveda and Yoga should be there, which will be primarily done by Skill Ministry, Line Ministry, Skill Ministry, but will participate. And there's another announcement is about 5 health hub where Ayurveda, Yoga and all these systems will be there. Primarily these first three pertains to Ministry of Ayush. So, we all know that this is a new cycle of 5 years. Our schemes are getting revised. It is under the process of interministerial consultation, and then we will get another 5-year cycles fund. We have projected a lot of new initiatives, and these new initiatives will have a lasting impact on our health sector. For example, we want to reach out to the homes and integrate Ayush and Yoga to the household. So, and then we want to do large scale behavior change communication, so that for every single thing we don't take medicine, we take care of our health, we own our health. So this is in public health. We are working with the states under National Ayush Mission. This is one example. The another example is that we have a lot of center of excellence. So you may recall that our Honorable Prime Minister at multiple occasions, in his speeches, in his Mann Ki Baat, sharing with the people of India, he always mentions that, this Ayush sector has a great potential and we need to work on generating large scale evidences. So we are working on it as a mandate. And for that, we have established a lot of center of excellence. And we are strengthening these center of excellences. Like we have partnership with Indian Institute of Science, we have partnership with IIT Delhi, IIT Jodhpur, we have partnership with AIIMS Delhi, ILBS, Institute of Liver and Biliary Sciences, we have partnership with IGIB, Institute of Genomics and Integrative Biology of CSIR. These are the examples, there are so many. So what we are doing is that we are trying to generate high-end evidences. So we are our scheme also supports this Ayurveda biology program, and we have also partnership with Tata Memorial. So large-scale evidence generation. This is one vertical. Then another is that we are also engaging with ICMR with large-scale big clinical trials. For example, we are doing a clinical trial on anemia on multiple sites. We are about to begin this trial on osteoarthritis or PCOS. We also work with WCD for, in aspirational district, there are more than 500,000 adolescent girls having anemia. So we are working with them. We already registered more than 100,000 girls for an anemia study or large scale observation study. What I'm trying to convey is that research front, we are doing whatever the global standard so that we can, have more and more evidences, and it is mainstream. In another front, I mentioned about National Ayush Mission is public health delivery system. In also we are doing a lot of collaboration, and then we have 12,500 health and center Ayushman Arogya is already established, and we will do another 12,500 in the next 5 years. Is we have proposed. So all of this, what can we summarize is that there's a huge demand, huge curiosity, and this integration, the Ayush modalities is very cost effective to exchequers, to the individual payers. And if this is integrated, it is sustainable, it is having no side effect. We have a lot of such studies. We have pharmacovigilance program also. So this is the time, where we can do a big thing. So we are using this budget. Like another announcement is WHO Global Center upgradation at Jamnagar. If you are aware that this is the first UN outpost established in any developing country, this is prestige of India, that we were able to get this full-fledged department of WHO in India at Jamnagar. So budget announcement is about the ecosystem development, because it's a family outstation of UN. So family outstation, there are certain criteria to develop. There should be, a specific level of schooling, specific level of residence. We are developing ecosystem of a global tradition medicine village there, a world-class museum, medical will travel. So lot of things we are doing. So we will be using this budget. Maybe we'll be short of having this fund. So we will be asking for more.
Okay. So, because you spoke about pharmacovigilance, so two questions related to that. One is because talking about Ayush drugs in the market, there's a lot of apprehension, lot of conversation about those formulations and the quality of drugs that are available, because all sort of vendors are selling, and there is no standardization as far as in my knowledge, or as far as now. But my question would be, what are the steps that ministry is taking to tackle these concerns or address these concerns? And also, there are certain reports we have seen lately that there are adverse drug reactions to ayurvedic medicines consumed by patients. So in such kind of conditions, where should we go for addressal, and where is the pharmacovigilance mechanism?
Actually, I should mention that there are two narratives that you have mentioned. One is that there is no standardization, which is a narrative. And second thing is that there is a lot of side effects, and there's not safety issue. This is also narrative. So actually, in a democratic country, such things happen. So it is okay. And then there are so many vested interests who creates this narrative, because they may be afraid of having a rapid expansion of Ayush systems. We have grown by 8 times in 10 years, which is unprecedented. So it is normal. So what we are doing is, first of all, that there are standards available. There are pharmacopoeia standards available. There are our entire system is governed by Drug Act, and we have separate chapter. We work with the states. There are state licensing authority mechanism, and there is a GMP standard. So all manufacturing facilities should be complied with GMP standard, and there are set protocols, set standards. At implementation level, in some states there are some lacuna that we are working with them, but it is not true that there is no standards available. So the standards available. We have mechanism of Ayurveda, Siddha, Unani Drug Consultative Committee. The we have also this mechanism of a board which creates the regulations, and then it is all done by through a larger consultation. So what all of these regulations are, whenever it is modified or it is put in public domain, taking people's feedback. This is one mechanism. Other thing is that we have recently in December, during this WHO Global Summit of Traditional Medicine happened in India, is a second such summit. 107 countries participated. Out of that, 25 health ministers came. So it's very big. Honorable Prime Minister came. So during this event, Honorable Prime Minister has launched this AYUSH Quality Mark Scheme. So this Quality Mark Scheme is to sensitize, to actually motivate the industry to comply with the global standards. So we came with a minimum government and maximum governance. Its model is the present government's model. So what we are doing, if somebody has a ISO 17012, if somebody has ISO 22000, if somebody has HACCP, if somebody has a WHO global, WHO GMP standard, they become eligible to get this AYUSH quality mark. So it's motivation to industry to comply with the quality standards. About the pharmacovigilance, I'm happy to share that since 2018, we have a very robust pharmacovigilance mechanism. We have one national coordination center at All India Institute of Ayurveda, Delhi. There are 97 sub-centers. There are 4 regional centers, and then it's more than 100. So what we do that we have a lot of sensitization program for the practitioners, for the hospitals, and so slightest of side effect we try to get it recorded, and even a common people can go to our Ayush Suraksha portal. We have a portal Ayush Suraksha, and they can record their their observation, and then we follow with them. You will be happy to know that more than 3,000 such side effects were noted since 2018. None of them were fatal. All of them were auto-reversible. It is normal that we are all different. So even in my practice life, I am a physician. So in my practice days, I have seen people having even sensitivity to Loki. Loki is most safest thing, healthy thing. So some people I found that if they consume Loki, they have diarrhea. So it's individual specific thing. So individual specifically, there are some side effects, some stomach disturbances, some nausea type of thing, but there is no serious side effect.
And these side effects are being reported on the portal.
Reported and followed. Portal we have launched recently in 25, but these 100 centers are actually they are recording these side effects and reporting to our national center. Our national center, with the help of our regional centers and these peripheral centers, we follow with their side effects. If I have noted some side effect, my physician noted, then my physician follows with me that uska kya hua, what happened next, and then most of these side effects are auto reversible in 1 or 2 days.
So one small question on that, because there are a lot of small scale practitioners, let's say in small cities. Whenever we walk into some small tier 2, tier 3 cities, we see a lot of Ayush practitioners. So how do you plan to bring them together into this?
Actually, we have visualized, when we started this program. So we have conducted large scale training programs. We have created master trainers, state specific, and for example, we have 450,000 practitioners, Ayurveda practitioners, and total 650,000 overall Ayush practitioners. Ayurveda, Siddha, Unani, 650,000. Already we have trained around 400,000 practitioners about pharmacovigilance. It's a big number. So we are sensitizing them, and 400,000 is already done, and it is a dynamic process, continuous process.
This is both from the north and the south?
All over the country, because all these 97 centers, the peripheral centers located across the country, there are 4 regional centers who coordinates with the peripheral centers, and 1 national center in Delhi. So the national center actually coordinates with all these things, documenting the thing, and then follow up with them. This is very, very robust, and it is one of the model that we have showcased during this WHO Global Traditional Medicine Summit, because no other country, including our neighbor, they have such robust system of pharmacovigilance.
Okay. And where are the 3 national institutes of Ayurveda coming up?
Actually, these 3, this is just announced. So Ministry of Ayush is working with the states, and then we are in consultation with the states, and we have received demand of lot of states. So there are certain criteria that we are fixing, and then we will be evaluating that. It is a process. So once, maybe in few weeks it will be decided.
All right. And so, government has positioned Ayush as a pillar of integrative healthcare. So my question is that will there be some sort of a structured coordination with the allopathic systems also? Because whenever you said you're collaborating with AIIMS and all the other hospitals, big tertiary hospitals. So are there any plans for some sort of joint treatment protocol, any cross referral system, or any shared clinical guidelines between Ayush and modern medicine?
So you have 3 questions actually. One is that is there any ecosystem which is in public delivery system? Another question is that do you work with the high-end institutions about these types of integrative protocols? And third is there anything happened already? So all these 3 questions are really encouraging. First of all, we are working with Ministry of Health and Family Welfare. There is a coordination mechanism We have DGHS vertical of Ayush under DGHS office, and this coordination mechanism is so effective that we were able to establish out of 750 districts, or we are able to establish at least around 475 plus districts where Ayush you know Ayush is there at the district hospital level, as Ayush vertical is there. There are thousands of co-located facilities, at PSC level, at CSC level, where Ayush doctor is there at under decentralized mission. So this is one at public health delivery system. We also have working with the non-communicable diseases program. We work with national mental health program. We work with de-addiction program. So Ayush protocols are there. We also work with geriatrics uh, uh, with the Ministry of Health, supporting the geriatric. We work with social justice ministry where they also support the geriatric population, and so this is one thing. Second thing is that this DGSS vertical has already published protocols on musculoskeletal disorders, protocols on lifestyle disorders, non-communicable disorders, and now they are working on neurological disorders. So these protocols are actually a joint protocol where experts of modern medicine also sit together. They reviewed actually, and after they review and concurrence, this is published. It is in public domain. So DGHS Ayush vertical has this propagated this. They have a training program for the states. So it is mainly now at the level of implementation at public and delivery system across the states. So this is happening. There is a mechanism of cross referral, where to refer whom, जो जहाँ अच्छा है उसको use करना. This is the idea. Third thing, you have also mentioned that for integration any high-end mechanism, any coordination mechanism. Yes, we have Center of Excellences, as I mentioned. We also have the Center of Excellence at NIMHANS, for Ayush, and we have a Center of Excellence at AIIMS Delhi. Other than that, AIIMS, apex body of AIIMS, have recently decided that they already have Ayush wing in all new AIIMS. So they have decided to upgrade this to a full-fledged integrative medicine department. So there will be a teaching faculty there, a professor, associate professor, and assistant professor, and senior residents, etc., like in other department. So this will be a unique one. No other country is doing this, and then once it happens, you can see that there is because once AIIMS do something, it translates to the all medical colleges and across the country. So this is also happening.
Okay, I think one more last question on advertisements. So the ministry, I mean, there are a lot of ads that we see of Ayush products, uh, also often misleading, so-called misleading ads. Is there any mechanism to look at them to address any sort of misleading ads going around?
First of all, you can see that in print media we were very, very effective to handle this, because print media is not so much like a flood. So we have this pharmacovigilance. One of the mandate to pharmacovigilance peripheral center is to report misleading advertisement.
So, sorry for interrupting you. Can you also explain for the viewers who don't know what kind of misleading advertisement are you coming looking at?
There is a law, Drugs and Magic Remedy Acts, and in this act, for certain disease categories, it is prohibited to claim the cure. I cannot claim that I will be able to increase your height. I cannot claim that I will cure your cancer. I cannot claim that will be helping you to reduce your weight, like that. So those claims are prohibited, and that is violation of Drugs and Magic Remedies Act. So what we are doing, that because health comes under state subject, so we collect these informations from pharmacovigilance. We have got this reporting of more than 65,000 such misleading advertisement in last 8 years. We refer it to the state licensing authority. They immediately take action. They notify these advertisers to stop it. So in print media, largely we are able to to manage this. In the social media and this electronic media, because it becomes like a flood. So I don't say that it is not possible, but it is bit difficult to handle this, because you stop one and then 10 more are coming. So we are working with this social media intermediates like Instagram, like Facebook, we are working with them, and then we have recently created an ecosystem that we have got a gazette notification also. So we have got a team under National Pharmacovigilance Program authorized to direct these social media intermediary to remove certain contents, whether it is on YouTube or Instagram or whatever. We already started into these areas, and I'm sure that in next few months, this will be very, very effective because it has just started.
All right. One more question. I'm so sorry. Then we'll end it. So this is about. I recently went to NIA Jaipur, and I saw that a lot of students. There was a huge crowd of students, and a lot of students are actually taking interest in studying about Ayush and Ayurvedic medicine. So, which means that more and more people will be, more and more students will be graduating in this field. So, what is the government's plan to actually place them? To what sort of work will they get? Where will they practice?
Actually, you know what? First of all, we want our students to come out from this, that it is only practice is the domain, because there is a huge opportunity across the sectors. Like we have medicine plant cultivation is one area, we have research in another area, we have teaching is another area, we have this startups ecosystem developing digital tools and ecosystem. Like this morning, uh, we have visited Old Institute of Ayurveda. There we have a startup incubation center. So one of the startup is working on nadi yantra, like a, a variable of pulse diagnosis, and so that kind of thing. So lot of opportunities, industry setup, manufacturing, practice, service in the government and public and delivery system, lot of opportunities. As a matter of fact, it is becoming difficult to get a good quality Ayush doctor for any such task, because there is a huge opportunity. They are absorbed as soon as they are out. It is true that the people who is highly competent, they are absorbed. But if some persons are not competent, they find it difficult. But we are, what we are doing continuously, upgrading our education system, bringing in transparency and make them highly competent. That is what we are supposed to do, so that wherever they go, they can deliver. Like recently, our bilateral, our FTAs happened with New Zealand, with last year with Australia, with European Union. All of these FTAs, we had, one of the point is traditional medicine integration. And then these countries, including European Union, you may have seen that they have agreed to allow Indian degree holder Ayush practitioners to practice into their countries. So this is opening new avenues for them. So this is happening.
All right. Thank you so much. I think that's all the questions I had. Thank you so much for joining, Mr. Kotecha.
One thing
Pleasure
I
talking
want
to
to
you.
add before we
Sure,
close,
sure, you can.
it is about the undercurrent. So we literate people who speaks English, they don't know what is the undercurrent. Undercurrent, we have got an example. Is we did request the Ministry of Statistics and Program Implementation to do a NSSO survey on Ayush, and they did it in the year 2022, and they analyzed it thoroughly. And January 24, it is published, so it is in public domain. In this survey, 96% of urban population, 95% rural population, they said that they are aware about Ayurveda, Yoga, and Ayush systems. And there was a specific question that how much do you spend? It, in surveys, you cannot ask direct question because it becomes biased. So the question was that do you spend 1,000 rupee or more for your health? 50% of them said yes. And when you populate this figure, it becomes 70,000 crore rupee. So that kind of undercurrent is there. And there was another question that do you, one of your family member do yoga every day? So around 5 crore household, which becomes at least 25 crore people numbers. Family size is average 5. So 25 crore, it means that you have around 6% of your population. One person is doing yoga every day in their family. One person every day. So penetration of yoga in 6% of family or 6% of population or 6% of household is something, very, very highly valuable. So what I'm trying to convey is that there is a huge, huge, huge curiosity, undercurrent, demand. As a government, our task is to facilitate providing qualitative things, products and services, and then let them benefit it, because our vida, our sector is very, very cost effective. we do not require a lot of money. If even if it's out of pocket expenditure is nothing, per capita expenditure for health in Ayush sector is very, very minimal. So this is the solution that we want to create for the globe, for our country, and I'm sure that it will happen.
All right. Thank you for that insight. Thank you so much for joining, sir.
Thank you.
Thanks for watching The Print. I am Sneha Richhariya with my colleague Sakiba Khan in Delhi.